We used to host these events in our community room next door, but we have found during COVID, one of the blessings of COVID is that we can get a lot more people in Zoom than we can in our community room next door, which maxes out at about 20. So we, as I mentioned earlier, are expecting about 85 folks today. So really appreciate the interest in the topic. Really appreciate you showing up bright and shiny early to be with us. And just glad you're all here. I am going to go ahead and share my screen. And remind you that you are here this morning to hear about the point in time count. I want to emphasize before we even get rolling that the point in time count is not Pillars initiative. It is a community initiative. You're going to hear a lot more about that as we go, but that's the first thing that I wanted to emphasize as we get started. Just a quick introduction to Pillars. We provide shelter support and solutions to address housing needs in our community. We do so innovatively and effectively. We want to ensure that episodes of homelessness are rare and brief and that everybody has a place to call home. And we're not the only ones who feel that way, and you'll hear from others this morning who do as well. You see our key values there at the bottom, grit being probably the most prominent of those. We work hard every day to live out that mission and vision. Just a quick glance of the services that Pillars provides. We serve along a spectrum of housing needs, from street outreach for those unsheltered individuals in the community, all the way to stable housing for folks who just need an adjustment of rent in order to make ends meet and build toward self-sufficiency in the future. So serving all along the spectrum, we operate 2 shelters, a day resource center. Our Ascend program serves young adults with mental health issues. We have a whole plethora of services and a whole bunch of great people, many of whom are here this morning, who make those services happen. We are going to be, if you're here, you're part of our team too. So I'm gonna ask Ayanda to launch a poll so that, because we don't have time for 85 people to introduce themselves, I'd love for you to get a glimpse of who's in the room with you today. So if you wouldn't mind taking just a second to respond to the poll, which I am going to see if I can catch myself. And what are you seeing, Ayanda?
So far we've got, the numbers is constantly moving, but we've got 19 community members, we've got 4 Pillars partners, we've got 8 donors, 11 volunteers. So far 52 people have responded.
Great. Great. All right. If you care to introduce yourself in the chat, you're welcome to do that as well. Just click on that chat icon at the bottom of the screen and tell us who you are and how you know Pillars. And now that's what we have for introduction, and I want to move on to the main event, which is the point in time count. We've got 2 speakers here to tag team and tell you about the point in time count, and that's important because, as I mentioned, it's a community initiative that involves more than 2 organizations. It involves many. You'll hear more about that. Tara Prahl is my colleague here at Pillars. She is our supportive services director. She has worked in the housing space since 2011 in multiple different roles. She was a shelter client advocate at what was Homeless Connections emergency shelter of the Fox Valley previously, now part of Pillars. And she's also a case manager, been a case manager with the Housing Partnership. Had an internship too with Harbor House domestic abuse program. So she has seen a lot of the needs that Pillars and organizations like us serve. We also have with us this morning Ryan Lodel. He is the coordinated entry specialist for the city of Appleton and the Fox Cities Housing Coalition's point in time lead for 2022. So Tara and Ryan will be tag teaming to share with you more about the point in time count. And Tara, did you want to say anything before you say something on the video this morning?
No, We can go ahead and play the video and then I can touch on things further.
All right, I'm going to stop sharing that.
Especially because then we can get off of that wonderful screenshot.
Okay, just a moment. I'm going to alert you that video over Zoom, despite every effort of ours to download the video and play it, tends to be laggy. So bear with us. And if you need to, close your eyes and just listen.
Hi, everyone. Thank you so much for joining us today and for your interest in the Fox Cities Housing Coalition. We are so grateful to have such a committed community support the struggles surrounding homelessness and housing instability. The Fox Cities Housing Coalition is comprised of approximately 30 member agencies who rally together to identify and tackle challenges related to homelessness and housing instability in our community. Members include agencies along the housing continuum, such as shelters, supportive housing, and even homeownership, along with supportive service agencies such as CAP Services for skills enhancement or Levin for financial assistance. The Fox Cities Housing Coalition meets on a monthly basis to learn valuable information from each other that can be shared with clients accessing our services. Along with the opportunity to learn, the Fox Cities Housing Coalition provides a space where agencies can learn about ways to increase services, collaborate on projects, and further our understanding surrounding the challenges clients face as it relates to housing instability. I am so grateful for the Fox Cities community and the banded effort that agencies take to support some of our most vulnerable community members. While we have learned that we are stronger together these past couple of years through the pandemic, the Coalition has been working this angle for over a decade. It's been an honor and a privilege to be a part of the Coalition, and I'm so excited to see what the future holds as the Coalition continues to address challenges relating to homelessness and housing instability in our community.
All right, so a brief introduction, and then Tara, I am going to share the PowerPoint and pass the remote control to you.
Okay.
Just a moment.
All right.
And here it comes.
Okay. Thank you, Lisa.
Mhm.
Good morning, everyone. So thank you for having me today, and thank you for allowing Ryan and I to speak to the point in time count and being interested in what we're doing with that event that we do on a biannual basis, and we'll get into that further. But the point in time count, as Lisa mentioned, is a coalition or a community event. So it's not intended to be a pillars owned or one agency owned event, but it's important for us to address it more and to talk more about it, what we've done and what we learned from doing that point in time count. But because it is a coalition event, we want to make sure that people have a background on what the Fox Cities Housing Coalition is. So you heard a piece earlier, and it virtually is 20 member agencies that get together on a monthly basis to come together and tackle the mission of the coalition, which is to ensure that all people in the Fox Cities have decent, affordable housing. Pretty plain and simple, but obviously it's not plain and simple when it's in practice. So it takes a lot of people at that table to pull that together. And I had found this graphic a while back, and I think it's a good representation of what functional coalitions look like and who's at that table. So kind of in that the middle diamond, it talks about that core group of housing services and support services as it relates to direct housing and direct shelter. And then at the table still, to make sure that we can really pull it together and have good conversations and expand, are a variety of other people and agencies that come to the table, which includes homeless assistance providers, public housing authorities, schools, mental health and social services, victim services, faith-based organizations, persons with lived experience of homelessness, and then the public and private sectors. And it's pretty incredible to be a part of the coalition. I want to say the coalition has been in effect for upwards of 20 years or so. And it's always been a pretty prominent group of folks in the community who are really dedicated to expand upon the opportunities in our community for housing and for shelter. And so here is, it is not going to the next slide.
Lower left, Tara, there should be little arrows that appear. Do you see them?
I do not see them. I'm not seeing any arrows.
How about that?
There we go. That works. So we're pretty fortunate in the Fox cities. We do have those groups at the table. And really it's an opportunity to be collaborative, to learn from each other, to support each other. So during COVID, obviously we've gone virtual, but I would still say that we've gained just as much traction and are moving initiatives forward just as much as we had even when we were in person. It's a blessing to be a part of this community. It truly is, to see this many people, this many agencies around the table. And these are just our paying members. We also open up the coalition meetings to guests. So there's a handful of folks that come still from even more agencies that may not be listed on this slide, but are coming on a regular basis and dedicated, including those from the faith community, UW Extension, Appleton Public Library, which they're part of the city, so they fall under that umbrella. But we just have a really great group of people that come together, that talk about how can we navigate these struggles that we're facing as a community. Within it, we do have a few subcommittees. So there's an affordable subcommittee, an engagement subcommittee, one for training, and then another to address the youth needs as it relates to their housing needs in our community. And so those committees meet on a regular basis, set up action plans, set up tangible goals that they can tackle to move that needle a little bit further down the road for homelessness and housing. And then part of the initiative, so a portion of what we do as a coalition is receive grants that come through both the state and the federal level. And those grants, while that's not the only reason why we came together as a coalition in our community, it is a huge point, and a huge part of it, because we need to be a coalition to receive those grants. And a requirement of those grants is to participate and conduct a point in time count twice a year, once in January, once in July. And Pat talks about it a little bit further in this video. So I'll let him explain, and then we'll get further into point in time.
The point in time count is a national effort that occurs twice a year to identify and quantify people who have no place to live. This includes people who are temporarily residing at shelters, as well as those who are unsheltered. The purpose of the count is twofold: to get a non-duplicative count of people who are homeless, as well as assist those who are unsheltered get into shelter and housing. The outreach portion, that includes where we search for people who are unsheltered. Typically, this means they are living in their vehicles or out in the elements, typically under bridges, in wooded areas, or in parking ramps and other areas like that. So locally, the last Wednesday in July and January from 11 p.m. to 3 a.m., 40 people from homeless provider agencies and community volunteers travel on foot or by vehicle in search of unsheltered people in the Fox cities, with the purpose of providing resources and information to connect people to those resources. Typically, we locate between 20 and 30 people during each count who are unsheltered.
Tara, do you want to take just a minute or actually Ryan, why don't you take just a minute to explain Pat's role and now your role with the point in time count?
Yeah, so thanks again for having me. So I serve as the point in time lead, and ultimately what that means is any data that is collected from the night of point in time, we're responsible for compiling and then reporting it to the state, who then reports it nationally. So as that lead, every point in time count, when we're interacting, when we're engaging with somebody, we're trying to get information. We're trying to collect as much as possible, as much as they're willing to provide. We're trying to connect them to services, and then again, kind of follow them through that path.
Thank you. Y'all should be seeing the slides again, yes?
Yes.
Great. Tara, why don't you just cue me when you want them advanced?
Will do. Thank you, Lisa.
Okay. Yep.
So we're kind of reiterating a little bit of what we've discussed in the video and what Ryan had shared, but the point in time is a statistically reliable unduplicated count of people experiencing homelessness during a designated one-night period. Wisconsin conducts this count twice per year. And while it's one night, there's actually two different components of it. So it's stretched out over a little bit more of a span of time. Once upon a time, it used to be one evening, and they've since expanded it, and knowing that we may not have captured everybody that night. So there's a lot of geographic area in the Fox cities, which is considered Outagamie County, Calumet, and northern Winnebago. And so to assume that we've combed every square inch of that in one evening isn't always entirely possible with the 31 volunteers or so that we have each count. So we do have an opportunity to do a service-based count as well. So the evening of, it's a street count. And then from then, which was last Wednesday, until this coming Friday, until tomorrow at 5 p.m., correct, Ryan?
That's correct.
Each person that presents at shelter or presents for services, we ask the question, where were you on the night of January 26th? And if they report that they had stayed outside or in a place not meant for human habitation, then they are included in those, the outside unsheltered count. Both of these counts, the two counts that occur, one is in January and one is in July. They're typically at the end of the month, that last Wednesday or so of the month. And we're always looking for volunteers to participate. So as we move closer to it, we shoot out information, we shoot out emails and a sign up, and people can sign up to join. And then we put folks in teams. They go out that evening and look within a designated area for those that might be staying in a place not meant for human habitation, or outside in their vehicles, what have you, someplace that wasn't intended for sleeping. So if you are interested in it, at the end of the slides, there will be a contact information. And then you can always reach out to me as well, and we can get you on the volunteer sign-up sheet. So when we are preparing for July, we'll have your contact information. We'll be able to shoot that email out when we're looking for folks to volunteer. And the last quote on here is regarding balance of states, how they interpret point in time or how they explain point in time. So a point in time is intended to capture a minimum amount of information on the homeless population in order to create a snapshot of what homelessness looks like in a neighborhood, city, or state. The data collected through the point in time process is reported in the annual Homelessness Assessment Report, AHAR, that is provided to the U.S. Congress. Homeless information is also reported to the U.S. Department of Housing and Urban Development and is utilized to develop the housing inventory chart for the balance of state continuum of care. So it gives us an opportunity to basically learn what we're working with and plan for what we need. And so as Pat mentioned, this is a national effort. So this is not just done within the state of Wisconsin or within the Fox cities. On these evenings, it's done throughout the entire state. And then I think even nationally, most of the time they're done on those exact days as well, because HUD typically defines the days that we conduct the point in time on. You want to advance, Lisa? So Ryan can talk about kind of what we've seen historically and what we've been reporting and what the state has learned about our community.
Yeah. So as you'll see here, kind of this is the numbers, right? This is what we've seen since January of 2019. I will preface, you won't see this January's as Tara mentioned, that service count does run through tomorrow. So to put anything out there would have been a little premature. Also, I expect it to rise from what would have been presented today. I also want to preface that we expect these numbers to actually rise significantly, and I'll kind of explain why that is. Previously, and even if we put 2017 and 2018 on this chart here, what was counted in that was transitional housing programs, rapid rehousing programs, permanent supportive housing programs. So it boosted those numbers that although they may be in a housing program and receiving additional services, they were still counted as it being a homeless program and therefore reflected in this count. So the numbers, if we had them up in 2017 and 18, were over 300 in 2017, 2018, it was high 200s. I do expect that number to climb again closer to 300 because they are adding those to the count again. Unofficially, at least that street count the night of, that number was 15. You might have heard that via media. That number's actually risen itself to 19. And again, we're still collecting through tomorrow. So when there is the formal presentation of the January 2022 numbers, I do expect those to be significantly higher than what you see on here. But again, with the preface that those housing programs are being accounted for like they haven't been since 2018. So expect more on this and more formal as those numbers become available. I'm hoping by the next Housing Coalition meeting, we are able to present formally on those finalized numbers, hoping next week to compile all of them and start to work on the process of submitting those to the state. So any questions on that? You'll see like I said, these are significant numbers. And it really is a testament to the investment of the community, especially the night count. We have some very dedicated volunteers, especially this last point in time count where it was, sub-zero temperatures, and we still had 9 teams, 30 volunteers out in the community doing their best to try to engage with, those in the community that are unsheltered.
Does anybody have questions about the data, about what you've heard so far? I have one for the sake of the audience. Ryan, when you talk about transitional housing, permanent supportive housing, can you describe that in layperson's terms?
Sure.
Those are terms that we toss around a lot.
Yeah. So those are housing programs that, as Tara kind of alluded to, that state and federal funding that is actually received by the city. So we serve as the fiduciary agent for state and federal funding that is received by the city of Appleton. We work with agencies such as Pillars, Advocate, Salvation Army to provide those housing programs. So a transitional housing program is typically 18 to 24 months. So there's a time limited duration that somebody can be in that program. And then there's permanent supportive housing, which is meant to serve our chronically homeless individuals that have been on the street for a long, long time. And it does not have necessarily an end duration in sight. They can be in it as long as they need it. It may be a year, it may be 6 years, but it's really meant to take those most chronically homeless in our community, keep them housed and help them get to a point where, down the line, they can be, self-sufficient.
And Tara, from the perspective of Pillars transitional support, permanent supportive housing, how many folks are we talking about that Pillars serves in those kinds of programs?
We have about 70 households that we serve across all of our supportive housing programs. Some of those are transitional permanent supportive, as Ryan mentioned. Some of those are our own unique programs that we run internally. And some of those are those that are funded by the state. And this Appleton serves as our lead on. And I do want to point out with the point in time count, well, they explain it in a way of numbers and data. It truly is about people, right? It's about the folks that are out there that are spending the night outside in a place not meant for human habitation. So as a state, it might be important to get a snapshot of what that looks like and how many the numbers are out there. But as a community, it's important for us to learn about those folks and get them connected to the resources available to them. So that is the most important part, is to offer our services, some that maybe have never heard of them, maybe new to the community, or others that are unfamiliar with them and maybe aren't ready to connect for some reason, or have some sort of barrier to connecting to those resources, to the shelters that we have available. Some folks don't want to go into shelters because they have pets, or what have you, or maybe it's just too hard to be in a communal living setting. And that's where our outreach team comes into play, and works with those folks every single day. So what we do for Point in Time twice a year as a community, our outreach team is out there every week, connecting with those folks and conducting their basically own personal point in times on a regular basis to connect to the folks that are out there and get them hooked up to services.
I see that, so the human side of the point in time count is indeed quite eye-opening. And I see that someone in the chat, Jenny Eichelberg, former board president of Homeless Connections, one of Pillars' legacy organizations, has participated. If you are on the chat on the Zoom this morning and have participated in point in time, would you mind chatting in, just saying I've participated, or maybe when you participated? I know there are a number of folks who have, including Pillar staff.
And to answer your question, Jenny, regarding how the pandemic has affected the time count, if it has at all. So I would say that it has affected it. And Ryan, feel free to join in on this one. What we had noticed is a lot of the shelters had to limit their numbers and their capacity during COVID. So they didn't necessarily have the capacity to serve as many as they had before, which is probably going to move people outside, unfortunately. And so in July, so this last July, when we conducted our point in time count, it was almost double the July prior? It was pretty significant increase. And is that because of the pandemic? Is that because of how the count was conducted? I mean, there's a multitude of variables that likely go into that. But I suspect that even statewide, and maybe Ryan, you know that information better than I do, we have seen an increase because at least during COVID, it was really in full swing because of that capacity that had to be shortened. I think we've all since started to increase and get back to our normal. But during, I suspect that statewide there was significant changes with what that looked like.
Yeah, there definitely was at the state level, and I'm trying to pull up really quick what those official numbers are. So give me a second on that. So I'll get you specific numbers, but I know they did see a double-digit % increase across the state in who was found. I mean, even if you look at back to the July count in 21, and historically going back to the data that I have, which is 2016, that was the highest number we had reported in a summer count. So right in the midst of that pandemic is a large number. And I think we can attest, and I know there's some of the street outreach team here from Pillars, but I know, even from the people that were found in this past January count, there was quite a few that were new first-time homeless in their vehicle, first time connecting with people. So that's something that we are seeing. And again, maybe the shelters can attest to that more, against street outreach. But just purely speaking from the point in time count, I know there was a few that were found that this was all a whole new experience to them, where a job fell through, or a housing opportunity fell through, or somebody just told them, can't stay here anymore, and they're trying to navigate this for the first time.
We have a question in the chat that was direct message to me. Do smaller communities do PIT counts as well?
If they, so it's really dictated by the funding. So if they are a recipient of those state or federal funding, that actually is required that a representative from their agency must participate in the point in time. For us in the Fox cities, that looks like Pillars, Advocap, Salvation Army, Harbor House, and the City of Appleton are those agencies that, due to funding that is received, are required to conduct and participate in a point in time count.
Great, thanks.
Including our friends in like the North region, the rural North region.
Yes.
They're going through some pretty dicey territory up there. And that probably looks very different each geographic location that you look at. But yep, and I think most of our communities do receive some level of funding that would require participation in the point in time count.
So we've talked a bit about the sort of technical aspects of the count, the data aspects of the count. Where do folks go in Appleton and in the areas that we serve? Where do they go? Where did they go last week when they went out looking around to try to find folks?
So if we connect with somebody, we do have an after hours plan that we put in place, which says, if you connect with somebody, where are they going to go? What are we going to do that evening for them at that time? It has been different because of COVID. In the past, Salvation Army has opened up their doors, and folks have been able to go back to Salvation Army, at least for the evening, have something to eat, rest, be warm or be cool, depending on what count it was, get out of the elements. Now with COVID in place, we've had a few more restrictions. So we've been a little bit limited and hit or miss on when we can do that, depending on when the swing of COVID has happened. So we always provide referrals to our shelters, whether they go in and do an intake at that time or opt to go another time. Others opt not to go anywhere. And then they all would get a referral as well to street outreach and to coordinated entry. We hand out coordinated entry information, and I'm going to let Ryan explain coordinated entry because that's his shtick. And so they would receive those access to services and those resources that are available to them.
Say if we're talking coordinated entry, we might need a little bit more time than what's allotted here, but just high level.
Layperson's terms.
Yeah. High level, it's a dynamic prioritization system that exists statewide to refer individuals and families to the housing resources in not only their community, but the community in which they wish to reside in. So it's a statewide database and prioritization system. So if we're actively serving or interacting with somebody in the Fox cities, and maybe they're not from here, they're from La Crosse, they're from Eau Claire, they're from Madison, Milwaukee, they're from Green Bay, we are trying to assess them, gauge some other additional factors, and then get them connected to those services. So it's a risk assessment where they usually get a score based on that, as well as other factors of their months homeless, if there's a disability in the household, individual or a family, if they're a veteran, if they're actively or if they're facing domestic violence, we then refer them. So whether that is in the Fox cities here, or if we're referring them to Brown County or Winnebago County, we are able to make that connection. And then based on those factors, it's a prioritization list. So I do want to point out that it's not a waiting list, it is a prioritization list. So based on those factors, they will fall on that list. And the way that I always describe it is, I could go into Pillar Shelter today and I could get assessed, I could score this, I could have this many months homeless, those other factors, I could have a disability, but then Tara might come in tomorrow and she gets assessed and she scores higher than me. She scores, she has more months homeless, she has some of those other factors that I maybe don't necessarily have. She would then jump me on that list. So it's a very fluid list. It changes daily. I run that list daily and review it. So it is a way to really take that highest barrier, highest need, individual or family that really needs, that is identified as the most in need in our community, and connecting them to that housing opening, whether that's with Pillars, Salvation Army, AdvoCap, but making that direct connection based on their need and their vulnerability, that to either be victim of a crime or to actually die on the street. And so that's that prioritization aspect of it, where it's really those that are most in need.
Great. We've got a couple of related questions. How are search areas determined, and where, same idea really, where do people look for persons that might be out in the elements? So I think sort of geographically, how do we determine search areas? And then more specifically, where are we looking? What sorts of places are we looking for people?
So we have a point in time committee that meets to pull the event together. And each time we look at our routes to see if they are the places where we want to look. And that's really guided by our street outreach team, because they are the folks that are out there and have the expertise on knowing where most of the people are that have been found outside or in another place not meant for human habitation. So usually Betsy, who's actually on this call, she oversees the RC and the outreach team at the resource center. Sorry, abbreviations. It's like a whole other language. They look at it each count to say, are these still the right places that we want to hit? Have we seen more folks in different regions? Including APD was also on that kind of subcommittee or that task to review and look at where are folks that they're finding as well when they're out just patrolling the area. So we break it up into 9 different teams, so 9 different areas, and it's between, typically we stay within more of the Fox Cities region. So Appleton, Neenah, Menasha, Kaukauna, Kimberly, Little Chute, somewhat out in the Grand Chute area. And based on those populated places that we've seen where people typically occupy that are staying outside. So if you want like specific places, it's downtown Appleton. Let's see, over Neenah, Menasha, it's a lot of like parking ramps, 24-hour businesses, parking lots, our parks. So a variety of different places where we typically encounter folks that are staying outside. And Betsy, if you want to say any more to that as well regarding kind of those regions where we typically see folks and how you identify that, even on a weekly basis, feel free to jump in.
Sure. You did a great job. That's exactly what we do. We do work with Appleton Police Department if they're seeing or hearing that there's different areas that they're seeing more people. Also, the public often calls the outreach team. And so if we get a couple calls or one call that someone might be struggling at this place, we typically check that out right away, and then just keep an eye on that area and might add that on our list. So we're we're really trying to keep a daily or weekly measures at where we can find people. And obviously weather changes a lot of that. So in the summer, we have a lot of wooded areas that we check, and their train tracks, and a lot of different places that we've found over the years that we check all the time that would not be an area that we wouldn't walk a mile into the woods in January, because nobody's back there now. They wouldn't make that. So it changes obviously with the January and the July count, but we work with the community and the police and our outreach team to find those places that we should check most.
I imagine that if street outreach is getting calls from the public about folks that have been spotted, the city is also getting calls from the public too, right, Ryan?
Yep, definitely. And again, that's that involvement with our police department, right? They're 24/7. They're engaging, they're interacting with a lot of these individuals and sometimes families that are unsheltered. And I know recently, and again, this is a tip of the hat to Pillars, again, their street outreach team, and then kind of some crafty work putting together kind of I don't want to call it a general release form, but really anybody that's connected to coordinated entry, it gives us an ability to meet and have, so it's called case conferencing release, and basically allows us to meet with multiple agencies, essentially everybody that we want at the table, and to have conversations about these individuals. Maybe APD has something they can share about this individual. The Pillars Street Outreach team has something that they can share. I can bring it in as prioritization and the coordinated entry piece of maybe where are they at on the list? Are they close to getting into a housing program? So it gives us that opportunity to have a community conversation about a specific individual, about a specific family, and try to best serve them. I do also want to point out too, the APD component. Our Fox Cities Coalition is the only coalition throughout the state that has that direct involvement from local law enforcement. I know I have 19 other counterparts that are also coordinated entry specialists throughout the state, and they are, every time we discuss it, they're blown away by the fact that we actually have that direct involvement. We have a member of APD that is on these committees, that is participating actively in our coalition, and that just doesn't exist anywhere else in the state currently. So that's something, a partnership that, again, I'm sure Betsy and people at the Street Outreach and Resource Center can attest that that's a strong relationship that we're very, very lucky to have here in the Fox Cities.
That's correct, Ryan. We speak to APD and particularly a few officers who work daily, almost every day. So we're texting and talking. We have a great relationship with Grand Chute as well and APD. So that's a huge benefit to us.
Ironically too, Betsy, I don't know if you saw in the email, we just got one from an APD officer as well. So yeah, those open lines of communication are phenomenal. And there's always this, it's not this way in every community. There's always, you hear about this criminalization of homelessness. And I think we strive to really try to work through what that looks like and to try to avoid that if at all possible. Because you're somebody on the street, you're struggling to begin with. Now you get hit with a loitering ticket or a trespassing ticket, and that changes things, because now you have a fine that you can't pay. You might, now there's a warrant, and so it just compiles an already rough situation.
Perhaps a related question, and Mark, feel free to unmute if you want to clarify your question. One of our participants is on the correctional side of social service and wonders if there's data for the offender population. And Mark, if you want to add to that question, feel free to unmute.
Hi, yeah, just was curious if there was any specific identification of the Fox Cities that, identifies those that are potentially in a more vulnerable state with correctional clientele, that it maybe have experience a lack of housing, due to, potentially their criminal profile that may not allow them necessarily to live in certain places. So I'm just curious if there was any specific data on that. I'm a mental health case manager with DHS, and so we struggle daily to find housing. And so I'm just curious, if there's anything specific for that population.
We do collect the information. So all intakes into any sort of housing program or shelter, they need to do a specific intake and assessment, and that does ask if somebody has been in jail or prison. Additionally, for the point in time count, there's a question on the survey that asks if somebody has been in jail or prison, and I think the last 12 months. The struggle with that is that when we are doing the surveys that evening, it's not always that people are going to complete them all. Because we are bothering people sometimes when they're sleeping in their vehicles. It's maybe midnight. That the point in time count is conducted between the hours of like 11 p.m. and 2-ish a.m. Until people are done with their routes. And so many people are sleeping. And so if they are, they're not necessarily ready to wake up and do a 3-page survey for us. So for the evening of, we don't always collect. We may have just an observation only form. But if they were to come into our service system in any way, they would have an intake in those questions. That question would be asked and it would be compiled in our homeless management information system. So do I have that data readily available on how many of those folks we serve that have that in their background? Not necessarily, but it is something that we could compile and we could pull rather easily for those that are within our system.
I appreciate that feedback. Thank you.
Yep. And I do want to say, Mark, that's also with a lot of these programs, especially the ones that go through coordinated entry, that can't necessarily deter them from getting into programming. So, some of the, if you're talking, and not to get off the rails, but, your Section 8 programs and some of your other HUD programs, some of those background issues may prevent them from actually being able to utilize a Section 8 voucher, public housing, things like that, where, something like a lifetime registered sex offender wouldn't be eligible for those programs, but, a rapid rehousing program or PSH program, they're still eligible for that. So that doesn't necessarily exclude them from being eligible.
Yes, very valid. Thank you.
Yep.
I know there was a question direct message to me about how street outreach follows up, how and if street outreach follows up with folks who are identified through the count. And Betsy, I know your team did some of that last week. Do you want to talk a little bit about that?
Absolutely. We we went to a couple places that were new, that someone found someone. So we immediately went there actually first thing in the morning to try to catch people right away. So I think on our way in, we met there. We unfortunately, the folks weren't there then, but we've been back to that spot a couple of times since then. So that's a great example of how we use the point in time to add additional spots where people might be getting some warmth and need some help. So, and of course we follow up throughout. I mean, our outreach team's out weekly, so we go to all of those spots and more. So anything we learn in point in time, we add to our routes. So thanks.
I'm sorry, I just want to circle back on this. I know they asked statewide kind of what that looked like. So I'm on the United States Interagency Council for Homelessness website, and for January of 21, and I'm guessing they'll be updating this shortly. Statewide, they reported 4,907 people, 4,907 people. So that was 21. That was up from January of 2020, where they had 4,515. So can put that in the chat so you have those specific numbers.
Community engagement team, are there questions in the chat that I've missed? Oh, one just popped in. How do you get them into shelter night of? One of the most painful questions that gets asked. Tara, you talked about it a little earlier. Talk about it again if you would.
It is one of the most painful questions. So if there is space, we will get them into shelter. we will refer them over there. We've even assisted with transportation over to the shelters to get them in to do an intake for that evening. However, we are running on wait lists at both of our shelters on a pretty regular basis. So if they're not able to go into shelter because we are full, we get them connected at least to our wait list so they can sign in on a regular basis and hopefully get in soon. That was part of the reason why we did open Salvation Army up, and will again once we're able to, is so they at least had a place for that evening. But that is also the most difficult part about the count and outreach's job on an everyday basis, is that we may not always have a place for them to go. And so we give them blankets and food and water, whatever sustenance we can, resources. And that's where outreach has come in and followed up with them before, or even, other folks. I know that I had encountered somebody once. He was outside. I went back the next day because I thought if he's still outside, like we got to work, we got to figure stuff. It's cold. It was last winter. He was still there in the same place. And it's heartbreaking. It's heartbreaking to see. And it's something that, as pillars and as a community, really as pillars, we navigate every day. Outreach navigates every day. And as a community, we discuss frequently on how are we going to work toward not seeing folks out there, not seeing folks outside at all. And that's a community effort. That's not one agency. That takes many of us because we all have capacities that we work within. And so we have adjusted. There's been an increase in outreach over the past. There's been discussion of motel hotel vouchers. We have a couple overflow beds over at our adult shelter for those that are outside and are referred directly from outreach. So we really do strategically talk on a regular basis about how can we address this, because it's unfortunate that folks are out there. And I think one thing is important to recognize is that not everybody wants to be in the shelter setting. So even if we provide the referral and could get them in and we didn't have a wait list, there's going to be folks that deny it for a variety of reasons. Some of it may be maybe their mental health is challenged right now, and being in a communal setting is really, really hard. Or maybe they're not interested in having folks kind of in their world right now. Maybe they're just not in that place. And so outreach builds that bridge to really, if folks are in that situation and they're not comfortable going into shelter right now, to build those relationships and give them an opportunity to build the rapport and help them hopefully get into shelter or at least housing. For some folks, their best output is housing directly through coordinated entry, and outreach makes that connection too. And then of course, during the day, Pillars has the resource center that they can access to stay warm, at least throughout the day, and get connected to resources and case management.
And that's a great point, Tara. And again, I'm sure Betsy and her team can attest to this too. Some, even doing follow-ups on people that were found on the point in time count that I did, they just, nope, I'm good. I'm good right now. And I think it's a testament to her and her team that, maybe not today, but maybe tomorrow. And they're, going to continue to try to engage and work through whatever their process is to get to the point where, yeah, I'm ready for a coordinated entry assessment. Yeah, I'm ready for a shelter bed. And it isn't always instantly, as you'll see. Like I said, there are some that just, nope, I got this set up in my vehicle and I'm okay. So it's working through that and trying to engage any way possible.
And it's important that we respect their autonomy, because forcing somebody into services they're not interested in likely isn't going to be terribly productive anyway. And so we want to be autonomous individuals. So we have to respect that of other folks and what their wishes are, and provide that with that same respect that we would want for ourselves. Because what we might think is best for somebody else, they may not feel it's best for them.
Gregory, I will get to your question in just a moment, but I'm going to call an audible here because you've been hearing from the pros here, the people who do this work day in, day out every day. I am going to ask an amateur, and I've gotten her permission ahead of time. Jenny Eichelberg, as I mentioned earlier, was president of the board of Homeless Connections, one of our legacy organizations, and has participated in the count. And Jenny, from a community volunteer perspective, what was that experience? If someone on this in this conversation today wanted to volunteer as a community member, what's that like?
So a lot of people are scared to do this, but you get assigned with an expert to go out. So you don't have to worry about not having experience because they put you with a group with someone who knows what they're doing, not saying that we don't know. But basically you meet, you get assigned to a group, you split off as a group with your expert, and you can do anything from checking out all the different parking structures and parking lots, like at Walmarts and various places, to going to laundromats, to walking through parks. There's just a lot of different routes, but it's very emotional and eye-opening when you start to see some of the places that unsheltered people stay overnight. And I feel like everyone in the community should do it at least once. I mean, I think it's just an amazing experience. So I can't say enough about it, and highly recommend that you sign up to try it at least once.
That was recorded, right? So we can clip that for the July point in time count, that testimonial. But yeah, Jenny, that's absolutely correct. And I do want to point out that we stress, and it's a heavy part of the planning, is the safety component. So nobody will ever be by themselves. It's at least a team of 2, sometimes depending on the route, a team of 4. There's a team leader that, you know, has done this before, they're experienced. So if safety is a concern, trust me, that's something we're taking into account with every point in time count. We strategically plan around that. That's again where the benefit of having APD in the conversation helps. And sometimes if there's a route where we're a little concerned about it, they've taken those routes in the past, where they'll just assign an officer to check out that area if we feel like there's some safety concerns. So that's front foremost, something that we take into account every time.
Ryan, if someone on this meeting this morning wanted to take part in July when the weather's more favorable,
Yeah.
how do they reach out? How do they let somebody know?
Yeah, so they can, so if you put up the slide again, there's Tara and my contact information. I also threw very early in this, so it's probably buried deep in the chat. I can grab it again. The FCHC, the Fox Cities Housing Coalition blog. Usually we start, usually a couple weeks before, we'll start to say, okay, here's the next count. I actually have, if you want to put it on your calendars, July, the night of July 27th into the morning of July 28th is when that next count is. So it's usually the 4th Wednesday of January, July. So more to come, obviously, on that. We do a video, we do a sign up, really kind of try to get some hype around it. So thank you for putting that back in there. But that's, yeah, if you're interested, like I said, let us know. I'm hoping maybe July, we're back to some more normal operations. COVID's really limited that. So absolutely, yeah, Tara, myself, or keep an eye on the Fox Cities Housing blog. Also on there is our meetings. So those monthly meetings that we've discussed, all the notes from there are also uploaded onto there. If you want to contribute on there and you have questions, it's a forum for our community to really talk about the housing issues.
I was chatting, and are meetings open to the public, PIT meetings? Gregory asked this question.
For the actual PIT meetings, they typically aren't because it is part of a committee. So we are kind of a well-oiled machine. It's like one of the best committees they've ever been a part of. We all have our tasks, we do them, we get them done, we're ready ahead of time. And so there isn't a ton of conversation that almost occurs, to be perfectly honest, because we all just have our tests and say, you're ready to go with this, you're ready to go with that. We just kind of get it done. The coalition meetings are open to everybody, as Ryan mentioned, and I feel like I owe him a candy bar for putting the blog spot out there, because I have been working diligently, even just with coalition members, to use that blog. And if you can't tell, he's on the engagement committee, so he's doing a fantastic job with that today.
It's my plug.
So yes, you're welcome to come to the coalition meetings. The point in time meetings, if you're really interested in joining, we're not exclusive anyway. So if you want to contribute, certainly you can reach out to me. We can talk about that too. They may be a little lackluster because it's going to be talking about our tasks to carry them out that we've been kind of doing for a number of years now. People have been, so.
Yeah, and I know in this, there's a lot of people that are part of that committee. It's one of those rare meetings that we schedule an hour, and it's usually like half hour max. We get through it because, like Tara said, it's a well-oiled machine. We review the routes. We think we got a good thing going here. But absolutely, if sorry, Gregory, if you want to participate in those and see what goes into that planning, I don't think at all we're inclusive of that.
All right, awesome. So just as we approach 8:30 here, I want to start by saying, if you have remaining questions, I know my team will stick around for a few more minutes. Tara and Ryan, I don't want to speak for you if you're able, but if you have questions that you don't want to ask in the whole group, I think stay on. For those of you who need to go, just want to point out that our next conversations over coffee will be April 7th, 7:30 to 8:30, same time, same place, Zoom. And then again, I would not be doing my job if I didn't tell you how to learn more about pillars. And there's great information out there available to you on our social media channels. But I want to thank our speakers for taking the time today, especially Ryan from the city for joining us. And thank all of you for taking the time and for caring, for wanting to know more about how we care for those folks in our community who are struggling with housing and how important it is that we do so together.